Welcome to this short video on the instruments used for suturing. We've already seen how to use a needle holder and how we grasp that with our ring finger, palm it, spin it, lock it and unlock it. We've shown how to use tooth forceps to handle tissues. We've shown how to use the tooth forceps to help grasp the needle and to spin the needle, so when you're working towards yourself and away from yourself, you can spin that efficiently using economy of movement. This short video is on cutting a suture, and you might think that, why do you need a video on cutting a suture? I've been cutting things since primary school. However, this is advanced suturing. This is not just everyday suturing. So of course, everyone can cut a suture because they have cut things at primary school. But on this occasion, what I want to do is show you how to confidently cut using both your right and your left hand, whether you're right or left-handed. And so to do that, what I want you to do this time is I want you to take your needle holder. And what I want you to do is I want you to lock your ratchet on your needle holder, and I want you to pass it into your left hand. Okay, all sutures pretty much are designed to be right-handed scissors unless you specifically order them. So all scissors are right-handed. So we're going to teach you how to cut with a right-handed pair of scissors using your left hand, because that's really important, because if I'm using my right hand to assist or grip something, or I'm holding something, I have to be able to cut with my left hand, and not many surgeons can do it. So this is an advanced lesson in how to cut with your left hand. So using your needle holder, what I want you to do is I want you to grab the eyelet of the needle holder that's away from you using your thumb and index finger through the hole. So like that, but holding it nice and firmly so that it's a nice stiff grip. I then want you to place your other fingers underneath the eyelet that's closest to you. When you do that, you'll notice that if you push up with these three fingers and down with your thumb, you're able to unlock the needle holder. It's more difficult to lock it, but it's quite straightforward to unlock the needle holder. And what I want you to do is I want you to do that for a couple of minutes and remember in your brain what it feels like to unlock the needle holder. And that's really important, because we're going to then take that feeling into our scissors. Okay, so once you've got that, set your needle holder aside and set yourself up a stitch to cut. So here is our stitch that we want to cut. So, as we've already said, anyone can cut a stitch right-handed, if you're right-handed, like this. Cut. However, it's more challenging to cut it left-handed. What I want you to do first of all is just take a right-handed pair of scissors and try and cut it. You might find that because the scissors are sharp, it might cut like that. But you'll find that with a lot of scissors which are looser, it's very difficult to cut sutures, and particularly very thin sutures. Let's take this braided suture and see if we can cut this suture. Here's a braided suture in my hand. I'm just going to cut it. There you go, it does cut left-handed, but I'm going to teach you how to cut properly. So what I want you to do is I want you to grasp the scissors in exactly the same way as you did the clip. We've got our thumb and index finger here, we've got these three fingers here, and I'm assisting here. I've got my right hand doing something else. I'm going to pull this up here, and I want you to feel that feeling. So as you're cutting the suture, you're pushing up with these three and down with these two rather, and you can very easily cut the suture. Okay, so practice that. Okay, practice with different pairs of scissors, palming your scissors like this, but practice on your needle hole first, because then you'll be really good at it, and you can impress people in theatre and in A&E. When your right hand's busy, you can pick up the scissors with your left hand and cut them.